If you're suffering with chronic back pain, you've probably scoured the internet going through the thousands of online videos that are promising to help you. If you're a subscriber of mine, you know we have over 300 videos, some of which offer highly specialized exercises. But what a lot of people are doing, even with the best of instruction and the best of intention, is that they've never been taught, or they're making foundational mistakes when it comes to performing those exercises. What that means is that you're not getting the optimal benefits that you should. I'm not talking about competing in a triathlon or squatting 1,000 pounds. I'm talking about foundational keys that most never talk about or most ignore, and I'm here to tell you how important they are, especially if you're trying to overcome serious pain. And guess what? 99% of people are not doing at least one of these 7 keys. In this video, I'm going to show you those 7 key foundational factors that you absolutely must do every time you perform any exercise. Stay with me to the end because most always forget number 7. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. The number one mistake most people make when it comes to exercise, especially if they're trying to recover from an injury, they're not getting professional help. I get it. Professional help actually requires an investment on your part, but this is a form of care. It's actual treatment. And the problem is when you're listening to the average exercise for the average person, and this average exercise may come from your personal trainer, it may come from another therapist. No one is average. It has to be specific to what you have. So please, and even my videos, we try to make the videos as specific as we can, but it is often best for you to get professional help of someone who's actually seen your particular injury. Hey, these people are worth their weight in gold, and you need to make sure that you're doing this form of care properly. The second big mistake people make when they're trying to recover from an injury with exercise is they go directly to core stabilizing and strengthening. Again, I'm a big fan of core. If you know my background, I've dealt with some of the best athletes in the world, but you do not put more pressure on something that still has too much pressure on it. You need to actually help to fix the injury first to get at the underlying causes, and then core comes down the road to stabilize and strengthen the area. Those are all the people that your well-meaning friends are saying, just go strengthen your core, you'll be fine. You get into the gym and you can't do any of these exercises, or in fact doing them aggravates the situation. If you're recovering from an injury, the first place to start is not with core. Number 3 in the list of mistakes that people make when it comes to exercise is they're not doing exercises specific to their condition. So for instance, you'll notice in my 300 videos, there is no one video that says the best back exercise of all time. It all depends what injury you have and what you're trying to recover from. So for instance, if you have a disc herniation, what we call flexion is terrible. Flexion is actually bending forward because that actually puts more pressure on the disc. And think of a disc like a jelly donut. If I squish the back, if I squish one side, the jelly is going to come out the other side. So that we want to stay away from flexion. Spinal stenosis, on the other hand, stenosis is when you're actually narrowing either the spinal canal, which then impinges on the spinal cord, or you're narrowing the openings where the nerves come out. That's called foraminal stenosis. Is if you're doing that, that's actually when you want to be bending forward. So 2 exact opposite conditions where one exercise is great for it, and if you have the other condition, that exercise is terrible for it. Those are all the people you see, especially the elderly in the grocery stores. They're all leaning forward on the shopping cart because that actually opens up the area and takes some of the pressure off the spinal cord. So again, your exercises when you recover from an injury need to be specific to that particular injury. And then of course it becomes more complicated where people always have more than one thing. So you may have a disc herniation and you may have a stenosis. That gets back to what we were just talking about right at the top, is that's when you need professional help. Number 4, you need to understand what I call the difference between a hurt pain and a harm pain. So you've heard that old adage, no pain, no gain. That's true to a certain extent, but when it comes to recovering from injury, that really should not apply. You want to do all these in a pain-free range of motion. So what that means is you're not trying to aggravate the condition. What we want is we're trying to take pressure off whatever condition that it is you're dealing with. So a hurt pain is going to be one where you're going to be doing your exercise and you might actually feel it a little bit, especially when it comes to weight training and so forth. But you know that that's normal with weight training, and you know that you're going to recover from that pretty quickly. A harm pain is one where whatever exercise you're doing If it causes numbness or tingling or pins and needles or sharp pain, or you instinctively feel like you're doing damage, you stop that immediately. Number 5, when you're doing that stretch, how long do you hold it? Are you holding it too long? Are you not holding it long enough? Do you hold it for 10 seconds, 20 seconds, 30 seconds? This is so interesting. What you want to do is you want to listen to your body. You want to accomplish what you're trying to accomplish. You're not going through the motions. You all know people who go to the gym, spend 3 hours in the gym, and 5 years later don't look any different. They're simply going through the motions. They're not really focusing in on any exercise. So when it comes to stretching, for instance, if I want to say stretch this side of my neck, I'm going to come over to the one side, and then do I hold it for 10 seconds, 20 seconds, 30 seconds? Well, what I'm doing is I've just actually made that muscle longer. I'm going to hold this long enough. I'm not going to count. I don't need to count. What I'm going to do is I'm going to hold this long enough that I actually now start to feel that that stretch is easing up. So if the stretch is eased up, then I know that the muscle has actually adapted to what I was trying to do. So it didn't matter if it was 10, 20, 30. For some people it might be 10. For some people it might be 60. That's now eased up. Now I could either go back or I could stretch even further, again getting more stretch in that muscle, again waiting until I actually feel the muscle ease up. Pay attention to your body. Go in not with the idea that, hey, I'm doing 3 sets of 10 reps and then I'm done. Go in with each single rep. I'm going to feel it ease up. I'm going to be accomplishing exactly what I want to accomplish. That is going to be huge, whether it's stretching or whether it's weightlifting in the gym. Big difference when you listen to your body. Number 6, there are so many people who actually do their stretching the moment they wake up in bed. The reason that's not necessarily good is there's a difference between stretching and warming up. People often think these are the same thing. A warm-up is something simply 2, 3, 4, 5 minutes where you're just getting some increased blood flow to the area. Stretching, you are literally trying to stretch the muscle. And then you'll say, well, then, how do I do, if I do the warm-up, are my muscles not, cold and not stretched? If I go into stretching right away, I haven't warmed up. That's why we do a warm-up that's an easy warm-up, one that really can't possibly put any strain on the body. That could be 2, 3, 4, 5 minutes of walking around, 2, 3, 4, 5 minutes on a stationary bike, something super easy. The reason that's important is we don't want to stretch cold muscles. So when you wake up in the morning, most likely you've not been tossing and turning in bed like an acrobat type of thing, is those muscles are cold. We need some warmth. So it's the one time, I'm a big fan of ice, but it's the one time you'd be far better off by actually walking around for a half an hour or even taking a hot shower, get some blood flow to the area, then get into the stretching. Difference between a warm-up and a stretch, and especially if you're suffering with a serious injury, we need to take this serious. We don't do this halfway through. Okay, this is something that we want to do the nice easy warm-up, then we get into the stretching. We treat it like any other activity that we're, if you're training for a marathon, you think, hey, this is serious training. Well, someone suffering with severe spinal stenosis or disc herniations or degenerative disc disease or any of these conditions, the sciaticas, failed back surgeries, is the simplest of stretches can be like your training for a triathlon. We need to take it seriously and we need to do it properly to avoid injury, but also to maximize the benefits we're going to get. And last but not least, number 7, don't forget to breathe. I know that sounds so easy, so obvious. Most people stop breathing for some strange reason. That includes personal trainers and therapists and doctors. Is breathing, understand this is all part of a physiological process. The more you properly breathe throughout the exercise, the better off it's going to be for what you're trying to accomplish with that stretch or strengthening move or whatever the case may be. Please take advantage of all the 7 pieces of advice that I just gave you. Every time you do any form of exercise whatsoever, you will benefit from them. If you found this to have benefit to you, then please share it with other people that you think would also benefit from it as well. People could be so much healthier if they just did things the right way, took the right action, and could get out of these injuries and so forth. Please share, please like, please subscribe if you haven't done so already. Please go watch this video next.